Dr. Frankel, 1 in 8 people are now with fibromyalgia using medical cannabis. Why is this a growing trend?
Well, I mean, every primary care doctor has seen many, 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 many women, because it's generally women. I mean, I can't remember even if I've seen a single man that was diagnosed with fibromyalgia. But fibromyalgia is one of those non-diseases that's more of a syndrome. It's generally middle-aged women with pains that are moving. Sometimes they can be confused early on with multiple sclerosis patients, but they have multiple joint tender spots and tender spots in their muscles, myositis, inflammation of the muscles, um, even inflammation underneath layers of their skin, and they get horrible trigger points. There's virtually always serious sleep disorder derangements with fibromyalgia, and often mood disorders, and that's probably why so many antidepressants, SSRI type drugs are being used, in addition to Neurontin, like a nerve calmer. But sometimes these just don't work, and the mood disorder, the sleep, and the pain are all tied in together. I mean, when these women go through difficult times, they sleep poorly, and they wake up with tremendous amount of pain. So failing, narcotics, failing anti-inflammatories, failing everything else, more and more people for every problem are turning to medical cannabis. Now, specifically in my experience, as anybody who knows me knows that I'm into dosable cannabis medicine, and that means knowing what dose of cannabis you're taking and what kind of cannabis you're taking. And molecularly, whether you're taking a rich CBD or a rich THC strain, or sometimes something in between. And in order to do this, we've evolved at Greenbridge Medical dosing schedules for fibromyalgia, multiple sclerosis, anxiety, sleep disorders, many other things using CBD-rich medications. And with the fibromyalgia patients, we're not sure whether a 2-to-1 or a 21-to-1 CBD to THC ratio will be the best medicine, but we currently have access to both of them and are doing studies with these patients, and we're seeing great results, and both for medical cannabis in general and specifically for CBD-rich dosable medications.